Cap Times Idea Fest 2020 is made possible by the generous support of our sponsors. Presenting sponsor, the Burrish Group at UBS, a financial services firm with global access and a local focus to pursue what matters most for its clients. Major sponsors are HealthX Ventures, backing entrepreneurs who are creating value with digital health solutions. Exact Sciences, pursuing earlier detections and life-changing answers in the fight against cancer. Quartz, health plans built with you in mind. And Madison Gas and Electric, your community energy company whose goal is net zero carbon electricity by 2050. Co-sponsors are Epic Systems and the Godfrey Kahn Law Firm. Other sponsors are Wisconsin Alumni Research Foundation, Home Savings Bank, Unity Point Health Meritor, Cargo Coffee, and the Forward Theater Company. Media partners are the Wisconsin State Journal and Madison.com, WKOW Channel 27, and Hinckley Productions. Please consider becoming a Cap Times member. Learn more at membership.captimes.com.
Hello, I'm Paul Fanlund, editor and publisher of the Capital Times, and I'd like to welcome you to this Cap Times Idea Fest session on COVID-19 testing in Wisconsin. Once again, our Idea Fest theme this year is 2020 Changes Everything, and it certainly has. Idea Fest has become an important event on the Madison calendar and is a showcase for the Capital Times. We'll hope you'll consider becoming a Cap Times member if you're not already. You will get more out of Idea Fest and out of the Cap Times. Learn more at membership.captimes.com. I want to again thank the Burrish Group at UBS, our presenting sponsor. Exact Sciences of Madison is also a major sponsor of Idea Fest and created the session you are about to watch on COVID-19 testing in Wisconsin. We enormously appreciate the support of Exact Sciences and its CEO, Kevin Conroy, who will appear in this session and has been a speaker on various topics in each of our first 3 Idea Fests. So thank you and welcome. Please enjoy the discussion.
Hello, everyone, and thank you all for joining us today for this very important discussion on COVID-19 testing in Wisconsin. I'm 27 News anchor Amber Noggle. I am so honored to once again be part of Idea Fest. Today, I'm joined by Chairman and CEO of Exact Sciences, Kevin Conroy, and Wisconsin Department of Health Services Secretary-designee, Andrea Palm. Thank you both so much for being here today.
Thanks
for having me.
We're going to start with some opening remarks from our panelists. So, Andrea, you can kick things off for us today.
Great. Thanks, Amber. It's really a pleasure for me to be a part of Ideas Fest as well. I think considering how long we have been in this outbreak, I just want to sort of level set and remind people where we were and how far we've come. First case in February, a single case that we cleared. We had an additional handful of cases in early March. Our first deaths were on March 19th. And now here we are today in an unprecedented response. We are at the highest level of response here in Wisconsin and are going on 200 days of that response. It is not something we have done. It's not something anybody's done before. And so I think it's really important for folks to remember when you're thinking about an under-resourced public health system and the health and safety of an entire state, an entire nation, the kind of effort and work that goes into a 24/7 kind of response like this. And as the lead public health agency, we know what we know. We know the science. We know how to do the nuts and bolts of public health, which are the things the words we all hear all the time now: contact tracing, testing, isolation, quarantine. We know how to do those things. We do them every day, every year. Tuberculosis, H1N1, they are the nuts and bolts of public health, but at the scale we are at, we needed a statewide response to this pandemic. And it is why we surged into our state operations center. It is why we knew we needed to bring to the table the assets and expertise of folks beyond the scientists, right? We needed warehouses. We needed logistics and distribution. We have distributed all over the state millions of pieces of protective gear. We've needed to have contracts to secure ventilators. We have done a whole bunch of things that, while are necessary for the health and safety of the state, were things that were to some degree outside of our wheelhouse at the Department of Health Services. So our partners at Wisconsin Emergency Management, the Department of Administration, the National Guard, and our nonprofit and voluntary sector, who've been critical partners in this response. But then, as somebody who's been in government for a while, one of the things I have learned is that when you get in situations like this, your partnerships outside of government can be just as important as your partnerships inside government. And it is those experiences that I think really helped us all embrace the idea that folks like Epic and AmFam and Exact and Promega and other private sector partners could really help contribute and bring to the table expertise, knowledge, assets, commitment, staffing, other things that were really helpful to us as we flexed up and out and have been able to run for the duration and what will continue to be, many more months to come. But it is those partnerships inside and outside government that have allowed us to do the kinds of things we've needed to do, whether it's around hospital surge capacity, whether, as I mentioned, it's around procurement of PPE and medical supplies, whether it's flexing our contact tracing infrastructure, whether it's the things we need to do and will continue to need to do around recovery and resilience as we start in the future coming out the other side of this. And then it's testing, which is, obviously what we're here to talk primarily about today, and our partnership with Exact Sciences and Promega. We have an incredible state lab here in Wisconsin. It's one of the most highly respected in the nation, but they had a capacity to do about 500 tests a day. And that, when you're talking about this scale of an outbreak, was not going to be sufficient. And so they went to work in partnership with their clinical lab network. Those clinical labs are primarily attached to healthcare providers, to hospital systems. And Kevin and I got connected and we started thinking and working together about how to bring to bear the assets of the private sector, predominantly Wisconsin-based companies, to this testing question. And it was the connection that a mutual friend of ours made early in March that I think brings us to today and to the lab capacity that we have, to, I think, a real success story in this response for the state of Wisconsin, is our testing capacity, is our partnership with Exact, is our capacity to really make sure that everyone who needs a test can get access to a test, and that we have the diversity to do as much mitigating as it relates to supply chain and reagent shortages, things like that we have seen plaguing the testing systems here on the clinical side, but also in other parts of the country. And so it's been a really important part of our response. If you can't test, you can't contact trace, you can't do isolation and quarantine, it all cascades from that initial positive or negative result. And so we feel very lucky to have Kevin and Exact here in Wisconsin, and Bill and Promega and our other partners. But I'm anxious because Kevin and I never get to chat. So I'm anxious to get to that part of our program. So I'll stop there, but I'm obviously happy, Amber, through the Q&A to dig into any of that or get to other details that you make sure you want to elicit from us. But I'll stop there for now.
Absolutely, Andrea. Thank you so much. We'll dive more into this partnership in just a few minutes, and of course, where our numbers stand today, where we need to go. But Kevin, any opening remarks that you wanted to share?
Yeah, well, first of all, thanks to the Cap Times. Idea Fest is such a wonderful exchange of ideas, and thank you, Andrea. We haven't spoken enough recently. After in March, speaking quite frequently. And the story is really a remarkable story of collaboration. Collaboration in a time of crisis. And really, I just want to thank you and Governor Evers for your leadership throughout this, with a lot of people, shooting darts. The truth is, a lot of different people with the best interests of the state of Wisconsin in mind came together in a really collaborative way. And that started back in the middle of March with a telephone call and a conversation. Can Exact Sciences help in any way? And certainly at that point in time, we were not thinking about bringing up a COVID test at scale. And that was a conversation with you or saying, yes, could you please talk with the state health lab folks? And that, we said, look, we think we can bring up a test. We're doing it for our own employees. And very quickly, we came to realize we had a lot of capacity, physical space in our labs, and robotic instruments, and then a telephone call with Bill Linton, and then engaging with the team from Epic Systems. I mean, Judy Faulkner's leadership and her team and that company's culture sprung into action to help. And then telephone calls to Bob Trunzo at CUNA Mutual Group and Jack Salzwedel at American Family Insurance. Within minutes, people said, yes, what can we do to help? And this is a story of the greatness of the people of Wisconsin coming together to help address a problem. And so really looking forward to having a conversation around that today, and proud of the work that has been done by a broad range of people here.
Yeah, it really is an incredible public-private partnership unique to Wisconsin. So you talked about this conversation that you had with the Department of Health, with Epic Systems, with Promega, this collaboration. So after this discussion, what exactly was the plan and how was it going to work?
Well, I know from our end, those conversations evolved over time to ultimately a decision on our part. We didn't know if we had the capacity, and on a Sunday afternoon, I went over to our newer lab facility at 650 Forward Drive and walked throughout the facility and called our head of operations and labs, Anna Hooker, and said, Anna, can we use this physical space? And she said, we could, but then we won't be able to do Cologuard testing there. And I said, well, we'll figure out that problem later. And was able then to call Andrea and say, look, I think we have a solution, but it's going to take a broad partnership to turn this into actually being able to deliver a test. And that's where the National Guard and Epic and Promega and others really came in to help out. I'm really curious to hear Andrea's perspective, though, because my memory is foggy about everything that happened.
Yeah, it actually is kind of amazing, Kevin, because it wasn't that long ago, but there's just so much that has transpired. But I think for us, when coming out of those initial conversations, as you articulated, and the really rapid yes, how can we help response? We spent some time figuring out how to plug in and utilize the assets of the private sector partners who were willing and interested in being part of whether it was testing or other parts of the puzzle, right? We drove our lines of work through task forces, and Epic and American Family and others became parts of those task forces and brought to bear their project management and other private sector skills on the problems we were trying to solve to stand this up in a statewide way. And similarly on the testing side, with the state lab, with Exact, with Promega, with the National Guard, how do we think about designing a testing system that can be flexible and mobile, and recognize that again, these are not assets that local public health has. How do we infuse them in ways that are responsive to outbreaks, that are responsive to the need for community testing, that are responsive in neighborhoods that have less access to care more broadly? How do we map this out in a way that allows us to bring to bear the critical piece that is testing to this response more broadly? And that really did take these teams, these task forces of folks with various expertise to develop that kind of framework, to put us in a place where we could execute and where we are doing the kind of testing we are now, which is tens of thousands of tests a day. It allowed us to think about our most vulnerable populations. How do we make sure nursing homes have access to testing? And we developed and designed and used Exact's assets and the National Guard to do routine testing in nursing homes. We are starting a second round of that now, right? That is a place where they just can't afford to get sick, and this kind of testing on a routine basis is critical. Same in other congregate settings like our prisons, like our 24/7 facilities that my department runs, whether it's the Winnebago Mental Health Institute or other places, again, where you have congregate living, shared common spaces, and where disease can spread quickly. So how do we make sure we're protecting those populations and the staff that work there? And so, it really was the infusion of private sector expertise into this infrastructure, the statewide response at the SCOC that allowed us to build the plans and to execute in a way that has brought us to where we are.
And let's break down a little bit about each role of the companies. So at Exact, Kevin, you guys had to actually retrain your equipment, which typically looks for DNA associated with colorectal cancer. So instead, you had to train your equipment to look for coronavirus, correct?
Yes, that's exactly right. The core science of what's called molecular diagnostics is using this amazing technology. You might see it on some of the crime shows called PCR, which the guy who invented it won the Nobel Prize. And the basic idea behind it is it can read the DNA makeup of a virus, of a cancer cell, of just a whole bacteria, a whole range of pathogens. And this technology had to be modified. The chemistry had to be modified to be able to detect the coronavirus, which our research and development team sprung into action to be able to do that. And then at the same time, to turn that test into a test where you can do thousands or even more than 10,000 samples per day, you actually have to have this really sophisticated automation equipment. And that's where our engineering team and our software team and our IT folks sprung into action to say, okay, let's imagine this at scale. And then a partner like Epic Systems said, okay, here's a team of dedicated people that can enable electronic ordering. Because when we first made this available, the test orders were coming in on pieces of paper that then somebody had to manually input into our lab system software. And Epic dedicated, I think it was about 15 people, and probably more than around the state, but just to write these software interfaces so that today it's about 80% of our testing is electronic ordering. At Promega, which helped with first you have to capture the DNA and get it out of this liquid sample. And they had that DNA extraction chemistry, and they had it tailored for this. So we were able to use their incredible scientific capabilities and deploy it quickly. So we went from zero testing in the middle of March to our first test before the end of March to thousands of samples a day 30 days later. This was a really highly coordinated effort. And I'll go back to what Andrea said about these task forces. The one that I interacted with, which was, I don't know, every other day on the weekends, it was a team of very serious people, highly capable people. This one was led by a National Guardsman, and I forget his name, but I remember getting off that call and saying, we are so lucky as a state to have dedicated people who are now away from their families, leading an effort to help make our state safer. And so there are a lot of unsung heroes here that someday I hope somebody writes a story of what happened, because they deserve a tremendous amount of credit.
Absolutely. And I think a lot of people aren't aware of this collaboration and what it took and how quickly it was able to happen. I mean, it's fascinating just sitting here listening to it. And Kevin, you mentioned a little bit about the capacity, but Andrea, where did this take us? How did this increase our testing capacity, and where do we stand with it today?
Mm-hmm. Yeah. So again, I think our testing capacity here in the state of Wisconsin is one of our sort of most unsung success stories. We're knocking on a capacity of about 40,000 tests a day. We're at about 38, but between the Wisconsin State Lab, who gives technical assistance to clinical labs around the state about how you run this test, how you make sure it's reliable and accurate, brings them on board. We continue to edge up every week. We add a few more labs as they have capacity, as they are able to come on board. And so they do that work as the state lab, continuing to make sure that as the clinical network expands, it expands in a way that is, again, most accurate and reliable as it relates to their capacity to run the tests. Our Exact Sciences partnership has continued to expand throughout this, and we purchase tests every week from them, as do other providers around the state. But we are in a place where we have more capacity than we are using, which is why every time I have the opportunity, I encourage people who have symptoms or who are close contacts of those who have tested positive to get a test, because they are available. And it is the first step to boxing this virus in. We need to know the result of a test so that we can take public health action to really continue to do combat with the virus on a daily basis.
And Kevin, this test was authorized by the FDA. Are these tests being used outside of Wisconsin or specifically just in Wisconsin?
Our testing, a portion of our testing is done from people who are sending tests from outside of Wisconsin. The majority of it is supporting the state of Wisconsin. And it wouldn't be right to have this discussion without noting that there are 115 labs in the state of Wisconsin today that are offering COVID testing. So Exact Sciences is a part of the solution. It's not the solution. And that really speaks to Andrea and Governor Evers and the state public health lab team that have helped guide the bringing up of tests and increasing the capacity to the 38,000 tests daily capacity that Andrea mentioned. It really has been a team effort, and we don't know what the future holds, because there are still stresses in the supply chain. We are not out of the woods in terms of maintaining even today's level of volumes that we're seeing. So people are, again, serious people are working around the clock to make sure that Wisconsinites have access to testing. And I'll take a step back here. If you take a look at one country, for example, South Korea, that has done an amazing job of combating coronavirus and really making sure that their economy is strong. They have done this by really very quickly wearing masks, doing testing, and doing contact tracing. And last Tuesday, the whole country of South Korea, which has 52 million people, had 60 cases. Wearing masks, having access to testing, and doing contact tracing can actually result in exponential decay of the virus. And so if we really said we want to address this, and 95% of people wore masks, you would see a 30% decrease in transmission. And that 30% decrease would go from exponential increase of the virus to exponential decrease. And 6 weeks later, arguably, you'd be less than South Korea. You'd see 5 to 10 to 20 cases a day instead of what we're seeing today. So I can't say enough. Let's all be great citizens and follow the advice of health experts and wear masks when we're around other people, and get tested and work with the contact tracers, because we can wipe this out if we just work together.
And Andrea, can we talk a little bit more about that as well? Obviously, we've had these policies in place to wear masks and certain things that you have received pushback on. So how difficult has it been for you to be able to do your job effectively with dealing with the pushback?
Mm-hmm. So I think, one of the things that I certainly have learned in this job as a relatively new Wisconsinite, is the pride and real affection that Wisconsinites have for their state and for each other. And so, the vast majority of people want to do the right thing. They want to protect their neighbors and those who are more vulnerable to severe illness in their communities. And so it is, while there has been pushback, as often is the case, it is a vocal minority that that really have concerns about mask wearing, for example. But I think what we have seen is Wisconsinites want to do the right thing. They need leaders who are clear and consistent about what the science tells us about the right things to do, and that messaging needs to be across the board. We all need to model good behavior. We all need to be clear about what would help stop the spread. We need to make sure people have the resources they need to be as successful as we can be in this very difficult time. But people want generally to do the right thing, and that that it's incumbent upon us to make sure they understand what those things are. So, we have seen a significant erosion of our authorities here in the state of Wisconsin as it relates to stopping the spread, whether that was the Supreme Court ruling or current litigation that's pending. And so, we're left to many, in many ways, to charm and persuasion, which is why I spend a lot of time in public settings, talking to the press, talking to the people of the state, trying to make sure they know what are the best and right things to do. And I know, people are tired of this disease. They're tired of this outbreak. They're tired of hearing me say the same things over and over again. But until we have a vaccine that is in, most Wisconsinites' arms, it is the world we are dealing with. And so I will continue to be clear and articulate about the best ways to combat the disease while we build the infrastructure we need to deal with the fact that our cases are going in the wrong direction.
And we'll dig a little deeper into that and where we go from here in just a little bit. But with this partnership, this is really just an entire community effort, a community coming together in a time of crisis. So how has that been for you guys to work together and to see the response and to see how people stepped up so quickly and were able, the power of community when you do work together?
I know for me, please, Andrea.
I was just going to I was going to piggyback on what Kevin said earlier about serious people and civil servants and the way the teams have brought their expertise to the table and have been collaborative and without turf about getting to a place where we were doing what we need to do for the people of the state. The mission was clear and people were committed to it. I think one of the things that this really shows for me, and I think hopefully for the people of this state, is that their government works for them. And when the chips are down, they do what they need to do to scale up in a way that allows us to have a statewide response that is as committed as it can be to protecting their health and safety until we get to the other side of this. But I think that really whether it was our wing assets, Kevin mentioned the leader of one of our task forces, or whether it was the technology expertise that Epic brought to the table that has allowed us to be 3 times as efficient at our community testing sites when we use that technology than when we were all on paper. And that was a really important project that stood up, and about 51% of our community testing now is using that technology and is allowing us to reduce wait times at community testing sites, get people in and out as quickly as possible. But we keep working to find ways to make the system better. As we're building the plane as we're flying it, and it is the creative, committed variety of private and public sector folks who are really bringing all of that to the table. They see a problem, they raise it, they bring a solution, and we drive. And that's our goal, is to continue to get better at this, to learn the lessons, to hear the science when it tells us something about the virus that we didn't know before, to adjust, to be as nimble as we can, and to allow the folks who are willing to bring their expertise to the table to do that and help us solve problems as quickly as we can.
Kevin, did you want to add to that?
I know, I have never been as proud about being a member of the team at Exact Sciences as I have been over the last 6 months, and seeing now altogether about 2,000 people at Exact Sciences play a role in delivering this important service to people around the country. And that starts with our laboratorians who've been coming into work every day since this started. There was no choice there but to continue to take care of people in our core mission for cancer, and then adding this on top of it in a time of tremendous uncertainty and stress and financial concerns, and taking care of family members. And the team came through. And then you look at the IT team and the human resources team and the engineering teams, all who came together and working nights and weekends with this fierce determination to say, look, we're going to make this all work, and then collaborating with so many folks. And it's really heartwarming to see people come together, putting all differences aside and saying, how can we make this great for the people of Wisconsin? And so, I just have to really thank Andrea for her leadership throughout all of this, and just steadiness. I've talked to Andrea early in the morning, late at night, and it's the same steady, calm, focused leadership. And we're really lucky to have her here.
Well, of course, thank you both so much for all you do. We are going to have to take a quick break to hear a word from our sponsors, but we'll jump right back in when we come back.
Cap Times Idea Fest 2020 is made possible by the generous support of our sponsors. Presenting sponsor, the Burrish Group at UBS, a financial services firm with global access and a local focus to pursue what matters most for its clients. Major sponsors are HealthX Ventures, backing entrepreneurs who are creating value with digital health solutions. Exact Sciences, pursuing earlier detections and life-changing answers in the fight against cancer. Quartz, health plans built with you in mind. And Madison Gas and Electric, your community energy company whose goal is net zero carbon electricity by 2050. Co-sponsors are Epic Systems and the Godfrey Kahn Law Firm. Other sponsors are Wisconsin Alumni Research Foundation, Home Savings Bank, Unity Point Health Meritor, Cargo Coffee, and the Forward Theater Company. Media partners are the Wisconsin State Journal and Madison.com, WKOW Channel 27, and Hinckley Productions. Please consider becoming a Cap Times member. Learn more at membership.captimes.com.
All right, welcome back, everybody. We're going to get right back to this conversation. Andrea, when we started out, it felt like we had a really good grip on handling the pandemic. And as you mentioned before in your comments, things seem to be going in the wrong direction now with our case counts and where our numbers are now for various reasons. Can you shed a little light on what you think may be pushing and driving these numbers, and how do we reverse that?
Yeah, it is the critical question, really, because we're absolutely at an important juncture in this outbreak. And we had a small surge in July. We put the mask order in place, the face covering order. We saw our cases decline, and now with the return of our 18 to 24-year-olds to campus, with the opening of schools, we are seeing a surge again. But I think it's important, while it is growing quickly in that age group, it is really important for folks to understand that we have widespread community transmission across all age groups. And so while we have certainly been focused, and you've seen more in the press about our college campuses and, quarantining of dorms or of other living settings, we are absolutely seeing a rise among all other age groups. And we are starting to see an increase. We're breaking records the last several days in hospitalizations and folks who are in hospitals. And so this is a moment really when we need to double down. We need, while we are all weary of this pandemic, it hasn't changed and the science hasn't changed and our tools haven't changed. And so that means wearing your face covering whenever you leave your house, making the choice to leave your house less frequently. We are in a place where we're seeing cases growing on a daily basis like we have never seen before. And so returning to some of those habits you had in March and April and May, where you made, one trip, one errand, one trip for your errands a week. You hit the grocery store and the farmer's market and the drugstore on the same trip. And that was it. And I think that people need to be thinking about making those kinds of choices again. We need to be really careful about our social gatherings. Asymptomatic transmission is a thing. We have learned a lot more about the fact that many more people who are asymptomatic are spreading the disease than we thought was happening earlier on. So just because somebody isn't ill doesn't mean they don't have the disease and aren't transmitting it. And so we need to be making choices that are more protective of ourselves and our family and our communities if we're gonna reverse course here and do what we ultimately said we were driving towards in the spring, which was protecting our frontline healthcare workers and our hospital capacity from being overwhelmed. And I think the reason it's no more critical than it is right now is because we are starting to go into the fall and into flu season. And we know that flu requires hospitalization for people every year. It takes lives every year. And so when you think about a local hospital system that is dealing with rising cases of COVID, with its normal business, with heart attacks and burst appendicitis or, all the other things that hospitals that come in their doors every day, you got that tranche of work, and then you're going to put flu on top of that. We are really going to stress those systems and those frontline healthcare workers who are susceptible to getting COVID as well. And so we're really taxing that workforce, and we're really taxing our infrastructure to treat people who do ultimately require hospitalization. So now is the time to make good choices, to take the actions that are necessary to stop the spread. And one of those is to get a flu shot, because the more folks who get a flu shot, the fewer of them will get flu and need hospitalization, and the more we are protecting that hospital capacity. And so that is an additional action that folks can take on top of the ones that we've been talking about since the start of this outbreak.
And, I think for a lot of families, especially my son is high risk. He's 2 years old. He has a heart defect. These numbers are very startling, and it's, it's a little scary for parents, for anybody who has someone high risk in their family. So you mentioned flu seasons here, and hospitals, the possibility of them becoming overwhelmed, and where we stand now, breaking records often. Do you foresee that in the fall that we could actually get worse than where we're at right now?
Mm-hmm. Well, I think, the thing we know about this virus is it's highly infectious, and absent intervention, absent action, it will continue to do what it does, which is spread. And so it is why continuing to wear masks, continuing to social distance, continuing to make good choices about how you interact socially with people, how often you go out to do your errands and other business. Some people don't have the luxury of staying home 6 days a week, but people who do should be making those kind of choices. Do curbside, do drive-through. Reduce those kinds of social interactions, even small groups. We have seen across the state outbreaks that have started just with small gatherings, where everybody was feeling healthy. But again, you had an asymptomatic person and all of a sudden 5 other people have it, and then they go to work, and it's insidious. It's very contagious. And so we need to be making good choices now, or this thing will continue to spread and continue to accelerate.
And I think a lot of people are kind of hanging on this hope of a vaccine. So in both of your positions, do you think it's possible that we could have one available anytime soon?
I know from being in the biotech industry and talking to companies that are focused on this, we are a long way off from having a vaccine that is broadly available to the US population. So the idea that there may be something before the end of the year is, the folks I have talked to who really know say that is unlikely, maybe first quarter for a certain portion of the population at the highest risk and on the front lines. But we have some time before we get to a vaccine. And that's why this concept of exponential decay is so important. If you do, take active steps to prevent transmission, we could significantly reduce the infection and the transmission rate, which could go a long ways towards doing what a vaccine would do, which is to hopefully wipe out the virus. There are other models. If broadly we can't get access to a vaccine for another 6, 9, 12 months.
And Andrea, I think it's important, this may seem repetitive for some people, we've heard it, but I think also we're so far into this now that some people forget what you should be doing. If you need a test, if you have symptoms, that after you get a test, you should be quarantining until you get the results. So can you talk a little bit just quickly about what people need to be doing and to help with slowing this down as far as getting tested?
Yeah, no, I really appreciate the question, Amber, because it's true. We either we didn't know because it wasn't necessary, or we've forgotten. But there are a few things, right? If you get a test, you should remain alone, in isolation or quarantine until you get the results. But if you have symptoms, even if you come back negative, you should continue that isolation. Because we certainly don't want to spread other respiratory viruses either. And so I think what I don't want is for it to discourage people from getting tests. If you have symptoms, you should get tested, because it is the only way we are going to stop the spread of this disease. But while your test is pending and while you still have symptoms, you should continue to isolate and quarantine and follow the instructions of your local public health officer, who knows the details of this and can give you good advice about how to monitor, how to take care of yourself, and when it's safe for you to come out of isolation and quarantine. I think beyond that, our contact tracers and our contact tracing infrastructure is very taxed. It is, if we continue down this path, we will overwhelm that system, and we continue at the state and at the local level to surge and to hire more folks into the contact tracing positions so that we can maintain a workload that allows us to do contact tracing in a way that helps reduce the spread. But for folks who have gotten tested or who are a close contact of someone who's tested positive, please answer the phone when you get a call from a contact tracer, and please answer the questions truthfully and be forthcoming about who you've been in contact with and where you've been, because it is that information that allows us to figure out what the circle is that we need to wrap assets around to stop the spread, to stop transmission. And so folks being willing to have those conversations, to be helpful to contact tracers and their local public health officers, is a really important part of how we know what to do once we have identified someone who is positive for COVID-19. So get a test if you have symptoms or are a close contact. Pick up the phone if you hear from a contact tracer, and do take the advice of your local public health agencies as they give you guidance about isolation and quarantine.
Are you hiring contact tracers now, Andrea?
Yeah, we have maintained around 200 contact tracers at the state level. What we did was, in working with our local public health partners in designing the contact tracing system, we provided funding to all of them to hire their own contact tracers, and we reserved some assets to be the surge capacity, essentially. So if we had an outbreak in one part of the state, one county, one city, one whatever, they could call us and say, we need to refer 100 cases to you. Can you do the contact tracing on those and then report back? We also heard from locals that Spanish and other language contact tracers were gaps for them. And so we focused also on making sure we had a variety of languages accessible through our state contact tracing resources, so that if that was an issue at the local level, we could again surge those bilingual contact tracers to supplement the assets they had in contact tracing. We are currently in the process of hiring about another 120 or so more. We would like to get closer to 300, considering where we are with this current surge, recognizing that contact tracing needs to be done in a timely way, so that the disease, the spread of the disease, the opportunity for that spread is reduced as much as possible. But our local public health departments also are hiring more folks. But it's a hard job. It is a taxing job. You hear very desperate and sad stories from people who you call. You also can take some abuse from people who don't want to hear from you. And it's a very taxing job. And I think not only here in Wisconsin, but across the country, people are having trouble retaining and maintaining enough of a contact tracing workforce to make sure that this is done as effectively and efficiently as possible. So we're very focused on that. We will keep our focus on that because it is such a critical part of this, but it is a really tough job.
And so for people who may be watching and may be out of work and looking for something, how would they apply and what qualifications would they need to meet?
Mm-hmm. So we are about to reopen our job posting on Wisconsin Jobs on the state website, and they are LTE positions, some full-time, some part-time, so that we can try to accommodate the needs of individuals who might be interested in doing these jobs. I think, right, empathy, compassion, attention to detail, ability to help people recreate their movements and where they've been and who they've been in contact with, to connect them with potential resources they might need based on the story that you're hearing from this person about their situation. Can they safely isolate or quarantine? Do they need help finding a place that they can go because they can't stay in their household for fear of transmitting to others in the home? It's a complicated and complex set of issues that you come in contact with. Everybody's different. Everybody has different circumstances. Everybody has different assets and resources. And so I think we have good training that we put people through before we'll put them on the phone, before we'll put them out there to have to take these kinds of questions and deal with the kind of issues that they face. But we need folks who can be thoughtful and strategic and compassionate, and who can help walk through the kinds of questions we need answered in a way that gets us at the level of detail that is necessary to do the follow-up public health work that we need to do.
Great. And speaking of hiring, Kevin, you're also expanding your staff at Exact Sciences. You have a number of positions open as well?
We do. We have 700 open positions around the country. Many of them here in the Madison area. And, I think One of the things that I'm really proud of is how engaged our employees are during this time of challenge. We constantly try to poll our team members and see how they're feeling, and we have seen a higher level of job satisfaction than ever before. And I think part of it is that people, despite that a job may be challenging, they feel like they're playing a role in fighting back against this pandemic, and that's incredibly rewarding. And so, if you are out of work or you're underemployed, please go to the Exact Sciences job section on our website. Take a look. Please apply. And we want more team members. Hopefully, many of these positions will be long-term Exact Sciences roles, and we'll be able to, eventually turn this fight from the pandemic to our fight against cancer, because cancer simply doesn't stop because of the pandemic. And so please go to the exactsciences.com website. After, of course, you've gone to Andrea's website.
I do have to say, Kevin, I have some friends who work for Exact Sciences and they love it. They're very happy with their jobs. So
great to know that.
Yeah.
If not, that's my fault. So thanks for sharing.
Yeah. So you've had to balance a lot with this, because you shifted what your employees were doing with helping with the tests. You're still doing the colorectal cancer screenings, and you also had some big news come out last week about this blood-based screening test for major cancers. Can you talk a little bit about this new test, and then how it's just been to balance everything in the pandemic and keep your employees safe throughout it?
Well, it's been a challenge. The great thing has been the leadership throughout the company to say, what can we do to make sure that we stay safe? That has been the first and most important principle. And on that point, we have seen a very low prevalence rate or infection rate in our employee population, which is tested frequently. Anybody who is coming into the lab, that's on our dime, not the state's dime, that we test our employees, and it's a low infectious rate. So people are taking the steps to be safe, and that's first. But this fight against cancer is real. And what we saw in the early parts of the year, where people stopped going in for preventative visits, it almost stopped, like 90% decrease in screening colonoscopies and mammograms. Get screened. Do not stop preventive medicine. Just during the April through June time period, because of the lack of those screenings, we experts expect to see an additional 10,000 cancer deaths just from that period of time. It's probably another 10,000. Now there's over a period of time because people weren't getting their mammograms or colon cancer screenings. Take care of your health. Still interact with your primary care physician. All of these things that are preventative, whether it's high blood pressure. We don't want to have two massive problems, the pandemic and deaths from the pandemic, but also deaths from very preventable conditions. You mentioned the data that we presented last week at a conference around a multi-cancer screening test. So 10 years ago, actually it was 11 years ago, when I first visited the Mayo Clinic and decided to join Exact Sciences after that visit, because Mayo Clinic showed data on colon cancer screening from a stool sample, and then also pitched this idea of screening for multiple cancers from a single blood draw. And over the last 10 years, we've done the really methodical scientific work to discover all of the tiny changes in cancer DNA that you can detect from a blood draw. And the data that we showed last week showed the ability to detect 84% of cancers from a blood draw, from a single blood draw, across 6 different types of cancer. Now the goal may be 12 or 15 types of cancer, and we have those known DNA changes, that what are called biomarkers. And we're really excited now to take the multi-year effort of doing the clinical trials and product development work necessary to bring that test to the people who need it. That's all of us, because cancer is the number one cause of death for people 85 and under. And a test like this could do more for prevention, early detection, changing cancer outcomes than any other tests ever developed for cancer. So we're excited to be a leader in this field, and we just won't stop until we get the job done.
Really just incredible, the work that you all are doing. And I have to say, as just a citizen, we're really proud to have Exact Sciences part of the community, and especially after, aside from all the work you're doing to fight cancer, just to learn more about this partnership and how you were able to step up and be able to balance it all. So, kudos to you, and thank you so much for all you're doing.
Thank you, Amber.
And Andrea, what's your hope moving forward in fighting this pandemic and getting us to a better place?
Yeah, I think I think we all are hopeful that the light at the end of the tunnel really is an effective vaccine, or several of them, recognizing that they are still, that it's not going to be widely available, by the end of the year, certainly. But it really is ultimately the way we're able to fold it into how we deal with it moving forward, and are able to truly return to a place that feels more normal than where we are now. And so we at the department and through our statewide response are starting to do our vaccine planning. We are anxious for those products to start rolling off, to be approved by FDA as safe and effective, and to start rolling off the manufacturing lines, and are starting to do that planning in anticipation of that. I think in the meantime, what I am most hopeful for is that people are still able to concentrate on where we are in this pandemic. Again, I understand how tired people are of this. But if we don't do what we need to do together, it gets worse before it gets better, for sure. And so I'm most hopeful that the commitment and the pride and the affection that Wisconsinites have for each other shows itself in the form of mask wearing and making choices about staying home and protecting each other, protecting the most vulnerable members of our neighborhoods and of our communities, and really doubling down together to reflatten the curve and make sure our hospitals don't become overrun. That's my hope for the near term. And then in the meantime, we plan for a vaccine, because that is ultimately the thing we need to get through to the other side.
And I've always thought that about the people of Wisconsin. It's really something how they rally around each other in times of need. And it's something that I've experienced since I've lived here that I hadn't seen in other communities that I've lived in. So, I think we do have the potential to get to a better place and to look out for each other. I wish I could talk to you guys about this all day long. We're getting to that point now where we kind of have to wrap things up. But I think it's important for us to end on a positive note, because, this is a tough year, and I think we're hearing a lot of discouraging news. So, Kevin, if you want to offer any words of encouragement as we move forward in this.
Yeah, I think the key thing is just showing how we can work together to help our fellow citizens. And to me, that just goes back to this idea of having a civic responsibility and putting our, basic things that you learn in elementary school, that is saying the Pledge of Allegiance. Okay, now, if those aren't just words, those are, a mission, something that binds us all together. And we have to ask ourselves the question every day: who can we help out there? Who needs help? And what can we do to play a role in being good citizens in Wisconsin and the United States together? And that's the beautiful thing about what Andrea helped spark and lead here from back in early March is let's get a broad group of people from the National Guard to the State Health Lab to EPIC to Promega to Exact Sciences and CUNA and AmFam, all coming together to kind of, help. And I think that's the positive news. It's having a positive impact.
And Andrea, any closing remarks you'd like to make?
I would echo what Kevin said. I think what you've seen in spades in this response and in the commitment of the people of the state, it has been borne out in these partnerships. These are folks who speak different languages, who have they work in different industries with different missions and different ways of doing business, and they came together incredibly quickly and figured out how to speak the same language and how to problem solve and drive towards the kinds of solutions that would help us fight this pandemic. And that it speaks to the character of this state and the resilience and commitment of the state to do for each other what is necessary to keep us all as healthy and safe as we can. It's been a privilege for me to sit in the seat I sit in and be a part of that, and to have the ability to encourage it and to facilitate it and to break down barriers when I could. It is, the governor's leadership that has allowed me to do that. And so I'm certainly grateful for that. But it is these moments of crisis and difficulty when you see what people are made of, and Wisconsinites are made of tough stuff, and they really have come together in a way that puts us in a place to do what we need to do when it comes to this outbreak. And I just feel privileged to be a part of trying to help facilitate, make that happen.
Well, of course, we thank you both so much for joining us today, but mostly just for all you're doing to help us get through this pandemic. I know you're probably pulling long hours and making incredible sacrifices. So it means a lot to the people of Wisconsin, and we thank you both so much.
Thanks, Amber, and thanks, Andrea.
Thank you, Kevin. It's great to see you.
It's great to see you. Thanks for all you do.
Thank you.
Yeah, thank you both so much. That'll do it for this discussion, and thank you all at home for joining us.
Cap Times Idea Fest 2020 is made possible by the generous support of our sponsors. Presenting sponsor, the Burrish Group at UBS, a financial services firm with global access and a local focus to pursue what matters most for its clients. Major sponsors are HealthX Ventures, backing entrepreneurs who are creating value with digital health solutions. Exact Sciences, pursuing earlier detections and life-changing answers in the fight against cancer. Quartz, health plans built with you in mind. And Madison Gas and Electric, your community energy company whose goal is net zero carbon electricity by 2050. Co-sponsors are Epic Systems and the Godfrey Kahn Law Firm. Other sponsors are Wisconsin Alumni Research Foundation, Home Savings Bank, Unity Point Health Meritor, Cargo Coffee, and the Forward Theater Company. Media partners are the Wisconsin State Journal and Madison.com. WKOW Channel 27, and Hinckley Productions. Please consider becoming a Cap Times member. Learn more at membership.captimes.com.